Hello, YouTubers! As you may or may not know, I was married about 2 months ago, and I inherited a 5-year-old little girl in the process. So the office has turned into a Hello Kitty and stuffed animal hotel, as you see. So that'll be the drop top, or the drop, can't talk, the backdrop for our show today. I am 3 months post-op from my lower body lift, arm lift, and fat transfer to butt. And that was my excess skin removal surgery after losing nearly 100 pounds. I'm going to talk about my third month. I'm 3.5 months out now. Last time I made a video was around the 8-week mark. So what's happened since then? Well, leading up to my wedding, which was in between weeks 7 and 8, my swelling was going down, 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 down to the point where I fit in my dress. So that was a good thing, because at my fitting I did not fit into my dress. So immediately after the wedding, my swelling started going up, 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 up. So the doctor had given me some Lasik, which I mentioned in my last video. That didn't really seem to do anything. He later mentioned up my protein. Tried that, worked a little bit, but not much. So I've just kind of been dealing with it. He did tell me a few weeks back, he said, give it another 3 months, see how it looks at that point. So a frustrating thing to deal with, but I'm dealing with it. So the way I know how swollen I am will be, I can actually measure my waist. At the smallest point, like right before my wedding, my waist was 34 inches. At the highest point since then, it's hit 39 inches. It's normally around 38 inches. But actually, the last, I'm going to say week, which I'm, like I mentioned, 3.5 months at this point, the last couple weeks, it's been around 36 inches. So I'm just up 2 inches worth of swelling still. He doesn't know exactly why. He says it's not a normal response. However, he says it's not really anything to worry about. Just give my body more time to heal. And in the meantime, I decided to go get a lymphatic massage because it is your lymphatic system that helps remove fluids from your body. So I went to 2 of those so far. I don't know that they're really working because that sort of thing takes time. The other thing I've thought about is I have a feeling that, when my body was cut in half, so let's say my body was cut right there, in the front of my body where the scar is connecting the 2 parts of my body, I'm actually developing a lot of scar tissue, and there's like some hard spots under my skin, which the doctor says I need to massage. So I asked the massage therapist if he thought possibly my scar tissue was preventing the lymphatic system from reconnecting and removing the excess fluids. He said absolutely that can happen. So that's where I stand with that. What else has been going on? I guess that's about it. I can see how some people fall into kind of like a depression after their plastic surgery. I've had some down days, but nothing that I would consider too bad. I think what's really helped me is I went into all of this with a very realistic mindset. I looked at a lot of before and after pictures. I tried to find people that looked similar to me before, so I had an idea of what I would look like afterwards. I did a lot of research into my surgeon and picked the one that I felt was the best at this type of work, which is Dr. Aga. I put his website below so you can see it, his other work if you're interested. But anywho, I went into this remembering a quote that I heard someone say that was, plastic surgery makes normal people look ultra normal. It makes the rest of us look normal. So I didn't go into this thinking that I was going to be some bikini model, but I went into this thinking, okay, I'm going to look like a normal person now, and I can wear a bikini if I want to. Can I be on the cover of a magazine? Probably not. But a lot of times the woman on the cover of the magazine doesn't really look like what she looks like on the cover anyways, because they do a lot of airbrushing. And speaking of bikini, on my honeymoon, funny story, my first time ever in my life wearing a bikini, because, I was fat since I was a little girl. So my poor belly has never really been exposed to the sun. And I wasn't out there for very long, and I did put on sunscreen, but I got burnt so bad. My poor stomach was like a lobster. And also the worst spot ever to get burned, I realize this now, was on my flanks, on my back. Those were so burned. But I knew a technique from my mom to, you make tea, let it cool down, and then soak washcloths in it and rest it on your skin. And I'm telling you that, if I hadn't done that, I think I would have had I don't even know how the degrees work, but like 2nd or 3rd degree burns. It was really bad, but because I used the tea, it actually kind of turned into a little bit of a tan, and it's since went away. So I will be more careful with my skin in the future that had never been exposed to the sun in the past. As far as how I feel now and wearing the bikini and all that kind of stuff, it's so nice not to be worried about your excess skin or your stomach or all that sort of stuff. So it's like I said, it's refreshing to be able to go out and not be focusing on that so much. Um, the only thing I need done now is to have the excess skin removed from my inner thigh. Um, I don't necessarily want to have another surgery, but I probably will have it done at some point. I'm probably just going to wait at least a year from my previous surgery. Also, when I showed the doctor my 3 month photos and I expressed to him my areas of concern, he said that I do look like I have a little bit of abdominal fullness, however he worded it. In other words, I have a little bit too much fat still in the front part of my stomach. So he said that next time I come in, he'll lipo that, and revisions are included. So whether I just go there to have the lipo done, or if I go there and while he does my excess skin on my thighs, he'll lipo that front section of my stomach as well. So but anyway, overall, I'm pretty happy with the result. Like I said, just dealing with the swelling. I guess that's all. So I will show you guys now what it looks like. First, I'll give you a whole body shot. Before, I wouldn't have been able to wear something like this because my excess skin it was like a ring around my waist. So it's very refreshing to have that gone. Here is my belly. I am pretty pleased with my belly button. My incision is very low. I'll try to pull this down so you guys don't get any peep show. And I'm going to turn around so you guys can see all the way around. Okay. I also had a request to show my butt because not really many people update after they've had a fat transfer of the butt. So I will just turn to the side so you can see. Previously, I really had no butt whatsoever. In fact, I think it actually kind of indented. But so that's my work thus far in a close-up of the incision. So you can see there. I can't feel it at all. It's just very smooth. It's like it's not even there. I can't feel it when I rub my hand over it. The only problem area I have is right here. Like I mentioned before, it is kind of hard, so I'm supposed to massage that. As far as my arms, let me show you those. So when my arms are up, like I showed you guys before, you can't see the incisions. You can't see them from behind. So I will show you a different angle, then you can see them. So there's my incision for my arms. Starts above the elbow, goes down into my armpit. If you're looking to have the surgery done, how long the scar is just depends on how bad your excess skin is. The doctor wasn't originally going to go into my armpit, but based on what I explained to him what I wanted, he did go into my armpit. I think that the healing would have been a little bit easier had he not gone into my armpit. But again, it wasn't that. I know some people have a little bit more extensive work, which is even worse. And I do know that if enough of your armpit is cut out, then you never have to shave your armpit again. So I wasn't that lucky. It did eliminate some of the hair, but not all of it. So anyways, I want to show you something interesting about my scar. How my scars normally heal, and let me back up. When the way I think your scars heal has one to do with the surgeon's technique and skill level. I think that's really important. The other one is your nutrition, your genetics, how you take care of the scar afterwards. So there's a lot of different things, and if you want your scar to look good, you got to keep all that stuff in mind. You got to, when you're picking your surgeon, and this is one reason I went with Dr. Aga, is because he does such wonderful work with the incision line. When you look at his after photos of the people that, he takes a photo 6 months later, year later, some of the people you cannot see the incision at all, and that's just incredible. So I'm hoping and thinking that eventually mine will get to that point. However, in the meantime, my body has a tendency to, the scar will turn pink or red, it will bump out, and then maybe a year or two later, it will turn skin color and it will go back down and lay flush with my skin. My incision around my body is actually laying very flat now. Sometimes it's flesh colored, other times it's very red, so it just depends on the time of day. My arm, however, is not healing as well. It's still good. I'm not upset with it or anything, but it is bumping out in some points. But a very interesting thing happened the other day, and I'm going to show you guys. Okay, so on my arm, you see it starts here, and goes all the way down to my armpit. Well, this section here in my armpit down is very smooth. It's the same thing, like when you feel it, you can't actually feel it. And it's smooth up until right there. Now from here to the end, previously it was all bumped out. 2 days ago, the first 3 inches, like right here where I'm running my finger, it bumped back in. So this whole section right there is no longer bumped out, and it actually happened on both arms. So this right here, it's like I can't even feel it when I rub my finger over it. But then this section from here to here is bumped out, and again, everything from here down is in. So I'm working to keep taking care of it. I try to wrap them at nighttime. I try to massage them with lotion or vitamin E. I was doing Mederma for a while, but I wasn't very good about doing it consistently every single day. But I'm also very good at my nutrition. I know that what you eat has a huge influence on how your body repairs itself. So I think that's all. I'm going to give you guys a before and after shots because I know I haven't like really put them together and compared them. One thing that I'm most excited about is I can wear jeans and a t-shirt. Before, I know it seems silly, but I couldn't. I always had to be very special about what tops I chose because I had that skin just hanging over the top like a muffin top, and it looked horrible. So I could never wear just jeans and a t-shirt, and now I can. And I don't have any excess skin hanging over the edge of my jeans at all. So I think, if I wanted to while I was working out, I could probably wear a pair of yoga pants and a sports bra and feel comfortable with what's underneath. So I guess that's all. I'm also going to show you guys a sneak peek of my wedding photos, which I promise one of these days I'm going to do like a whole transformation starting from the beginning through now, to covering even my wonderful wedding with my wonderful husband, and kind of give you guys like a whole photo and background and all that sort of stuff. And I'm also going to do a video talking about 3 years out from weight loss surgery and whether or not it is the easy way out. So stay tuned for those, and you guys have a wonderful Labor Day weekend.